Hi, my name is Kalpana Shrestha, and today I'm gonna be talking about about a clinical case study. The topic that I chose is relapsed bipolar disorder symptoms. So let's start with the bipolar disorder first. Okay, bipolar disorder is a brain disorder that causes unusual shift in the mood, energy, and the activity level. It is also known as the depressive illness. It can affect the day-to-day life of the person, as it can result in poor academic performance or a poor work performance. There might be several factors responsible or involved for the cause of bipolar disorder, such as the heredity factor, biological factor, and neurotransmitter. The treatment of bipolar disorder is determined by the nature of the symptoms, like how mild or how severe it is. If the symptom is severe, then the nature of the bipolar disorder is called hypermania. Whereas if the person has a mild symptom, then it is called hypomania. Bipolar disorder cannot be completely cured. However, manics can be prevented, and depressive episodes or the intensity or can be reduced. It requires the lifelong treatment as it cannot be completely cured. Avoiding the treatment can cause the relapsing of the symptom. If a person has a substance abusive problem, then they need the substance abusive treatment. If a person behaves dangerously or shows the suicidal symptoms or nature, then he may be admitted to the hospital for the psychiatric treatment to keep him calm and safe by stabilizing his mood. Therefore, the treatment of the bipolar disorder is lifelong as it cannot be completely cured. Okay, now let's move on to the case study. This case study describes a patient who is who is suffering from relapsing bipolar disorder. Okay, the patient was examined by the psychiatrist, and at the time of the admittance, he was reported with the suicidal attempts and depression, with other symptoms such as significant weight loss, catatonia, insomnia, recklessness, and hallucination. A mood stabilizer and an antipsychotic were prescribed. Few days after the first visit, the doctor recommended the day treatment program to provide him the support and the counseling while getting other symptoms under control. After a few weeks, the patient returned with the report of hypermanic episode. Following the preliminary questionnaire, he reported avoiding his mood stabilizer and antipsychotic prescription. And now he was asked to continue his medication without avoiding them so that the symptom won't relapse. For the continued treatment, he was recommended to follow the maintenance treatment as bipolar disorder cannot be completely cured and it requires lifelong treatment. The patient was recommended to continue his treatment, including psychotherapy, even though he reported that he was feeling better. The treatment was effective, and many of his symptoms were diminished, and as a result, he was able to function normally again. Thank you.